Happy October 1st. I'm going to be a broken record. I'm going to say it again. I can't believe it's October. This is actually one of the first years where it's starting to feel like fall in an appropriate sort of way, where it's like a gradual out of summer into fall versus like you have summer and then you have winter. With that being said, we just had a relatively warm week and we're going to have a relatively warm next week. But today, on October 1st, it is 70 and cool. Actually, it was like really chilly this morning. I actually got some mowing done, which spurred this topic today. And it was just a actually really enjoyable time outside. So I've spoken about this, I think, in reels on Instagram. And I actually think I was more focused on snow shoveling in this same sort of regard. Um, but I wanted to talk about the energy expenditure for doing activities like mowing. And besides having to mow this morning myself and like physically doing these things and thinking about like the level of activity that is required to do it, I had a patient this past weekend who had a recent um, iliac to femoral bypass endarterectomy for actually an occluded stent that had previously been placed. And he had really severe intermittent claudication at the lateral thigh and buttocks more than the lower leg. And he was actually a really active guy. And he's been down for pretty much the whole summer. And his wife has taken over the mowing because he physically couldn't do it. So now he's post surgery. And one of the first questions he asked is, can I go back to mowing? And the answer is always, it depends, right? So on a broad question, you have a patient, and the question is, can they mow their lawn? It depends. And this is where your skill and knowledge base comes in, because no two patients are the same. No two comorbidities list is the same. No two VO2 maxes for that specific person is the same. And no two lawns are the same. No two mowers are the same, right? Like there are so many moving variables in this picture. You have the person, you have their VO2 capacity, you have their physical activity level at this moment. You have to think about symptoms, and then you need to consider what's happening when they're mowing. Do they have a push mower? Do they have a ride mower? Do they have a flat lawn? Do they have an uphill, front yard? And I'm literally describing my own place right now. Do you have a small patch of grass that's going to take you 5 minutes to mow? Or do you have a good amount of space that might take you an hour or two, right? So time also is a variable that you have to think about. How long can you sustain said energy expenditure? So I'm not going to go into the real nitty gritty of MET levels, although I consider doing that, but that will be a much longer, more detailed conversation. But I think it might be worth doing because when we're thinking about activity levels, we can use MET levels to sort of help determine if a person is capable of doing said activity. Now, METs aren't perfect because one MET has a standardized number. And in real life, there's going to be variability to that based on age, sex, weight, height, body temp. There's a number of different things that sort of weigh into your resting metabolic rate. With that being said, we can use the standardized number to give us a quick and dirty answer. And for the most part, it's at least a good starting point. It's at least a good conversation starter, right? Can I mow? Well, can you perform X number of METs? So before I go any further, I want to give you a resource. And I actually love doing these podcasts because I just learned that this resource has just been updated in 2024. So the resource is called Physical Activity Compendium. This is a living, working document that was created, I believe, I think it was officially in production in the low like 1993, but was started in 89. And it literally lists out the level of met levels expected for a certain activity. So you can look at anything from like gardening to mowing to skiing or playing something like pickleball. Actually, I should check to see if pickleball is on there because that is a like a hot sport right now and a very common sport in the older generation. Learned that in Michigan. Do not mess with the older pickleball generation. They will crush you. Just forewarning. But this is a really great document that literally goes through all sorts of activities that you can think of, and it can at least put you in the ballpark of information. I just got out of the screen. Let me see if I go here. I'll give you just some overall titles. So you can go from bicycling, conditioning exercises, dancing, fishing and hunting. Home activities would include things like vacuuming versus maybe standing and doing the dishes. They typically give different met levels for like sitting versus standing. They also include things like minimal, moderate, vigorous effort, which is great. Self-care, sexual activity, different types of sports, transportation. They even had like riding an e-bike, which was surprised about that. They've added new ones actually in the 2024 update. Video games is actually one of the new categories that they added, and rightfully so, because actually I'm going to open that one because why not? They break it down between seated video games, which is a met level of 1.3, to video game with a handheld controller with light effort, 1.5. And then it goes all the way up to conditioning, exercise, virtual reality, fitness, which is a met level of 9.8. So again, no two things are the same. And this is actually a conversation I've had with gardening. If you have a patient that tells you that they garden, ask follow-up questions because gardening can be low-level activity. Like I have a planter box and I'm watering that planter box and that's as high level as it gets. Or your patient has a garden that they are upkeeping, which includes things like weeding and possibly turning dirt and being able to bend down and stand up, carrying bags of dirt, right? The variability is high. So you have to ask good questions. Let me talk about the lawn range for a second. So mowing the lawn can range from 2.5 to 6. 2.5 being the lowest level, which is a riding mower, and 6 would be a hand mower with vigorous effort. What most people are sitting at is that there's a 5 and a 5.5, and there's not a lot of differentiation between the two. Mowing the lawn, general, walking, with a power mower. So a lot of patients will tell you that like it's a power mower, it has an, auto go. So you're not pushing the full weight of the mower. If you don't have a power mower, you need to consider the weight of that mower as well. But 5.5 mets is about average for mowing the lawn. So what does that mean? It means a lot of things. So just first base information. How does one met level of activity affect the person? So again, averages, guesstimates, well-known averages. One met level of activity is equivalent to 10 to 12 beats per minute for heart rate and an increase in 8 to 12 millimeters of mercury for blood pressure. So we know that as we exercise, heart rate and blood pressure are going to increase. Heart rate is more linear than blood pressure, but they both tend to increase gradually in a linear sort of manner until you surpass submax exercise and start moving into max exercise. And then you have a more steep incline. But average, for one met level of activity, you can expect to have an increase in your heart rate by 10 to 12 beats and an increase in your blood pressure between 8 and 12 millimeters mercury. So 10's a good guesstimate, right? For every 1 minute level of activity, you expect your heart rate to increase by 10 and your blood pressure to increase by 10. Keep it simple. Okay, so then what does that mean for that person? Lots of questions have to come in here. Where does your patient rest? What's their resting heart rate? What's their resting blood pressure? What's their typical physical activity? Do they have a history of angina? That's a big one for me, right? So if they have a cardiac history, do they have stable angina? Have they had a recent stent placed? Have they had surgery, right? We're going to kind of keep that one off to the side because that has different implications. But if your person has angina and the question is, can I mow? Then you need to know where that threshold is. You need to know at what RPP, rate pressure product, does that angina start? Because you want to maintain at least 10 under that heart rate, blood pressure, right? You don't want to trigger that response. My next question would be, have they done a 6-minute walk test? Have they done a modified or regular Bruce protocol? If you have that information, this is a very simple yes, no answer. What was their max heart rate they were able to achieve? What was the max MET level they were able to achieve? And if you want to know it, then you can do a 6-minute walk test, use a predictive equation, which is quite long, so I'm not going to read it to you, and figure out what their MET level that they achieved. If they only can achieve 2 METs, then I would say, no, you should not mow the lawn, right? Because mowing the lawn is 5. Unless they have a ride-on mower, and then you have to ask more questions. Do they have the physical capability of climbing onto the mower, getting into it safely, right? From more balance, strength perspective. So there are lots of different factors to answer this very simple question, can I mow the lawn? You want to know if it's a push mower. You want to know if it has, power control, that it's going to automatically propel itself. You want to know how big of a yard they're mowing. Do they have any assistance? Can they, do they have the ability to like sit and rest? Or are they going to be, out in the middle of nowhere doing this? I have a neighbor, I'll tell you about neighbors, I should say. The best people, first of all, and second of all, they mow as a team and it's fantastic. So like I have them in my mind sometimes in this regard, right? If the husband was like, "Hey, can I mow? This is how we do it." This would be a great way to interval mow. Yeah, you mow, they literally do like one strip up and down and then swap. That allows for rest breaks, time to sit, time for heart rate recovery, staying away from angina threshold. Maybe if there is an incline in the yard, the other person takes the incline. So lots of different variables that can come in with such a simple task. But you can ask this question for anything, right? Can I snowblow? Can I go skiing? Can I ride a bike? There's so many follow-up questions, but you can really use this compendium to get a starting conversation. And if the answer is no right now, well, maybe this is a goal to work towards. I kept this surgical patient off to the side because it's not just about the heart rate, blood pressure, MET level response. It's also about precautions. So if you had a patient who had a sternotomy, well, you're going to have lifting restrictions, no push, pull, lift greater than 5 to 10 pounds for about 3 months, right? So 5, 10, 15 at its tightest, 10, 15, 20 at its, more liberal for typical precautions. No push pull, mowing's out. Even if you're not necessarily pushing greater than 10 pounds, like if you're on level ground, it's a propel mower. I don't know how much that force is, even when it's kind of helping you along, assisting you, but it gets dicey. And I had this conversation as I was mowing today because There's a change in the yard pitch. You have to go around a tree, and all of a sudden you're holding a mower on an angle. Out. I would say sternotomy, just wait. Wait for your full restrictions to be up. Now, my guy from the weekend, he was a peripheral vascular surgery. So they still have a 10-pound lifting restriction. They don't necessarily have a push pull. Same thing, they probably could do some of the level ground short bouts. But what happens if you have to navigate around the tree and you're holding the mower sideways and obviously doing more than 10 pounds work? Is it worth it? Right? For him, it's only so many weeks left in the season. Just, I would let it be. At the end of the day, your patients are adults and they can make their own decisions. And that is something that you have to consider too. But from an education perspective, it's probably not worth it. I had a couple of notes here. Yeah, so lots of different things you need to consider when asked a specific question. I know everyone hates the "it depends" answer, but to be very honest with you, it almost always is "it depends" because it depends on you. It depends on your patient, right? Everyone is different. So most things aren't black and white, and you have to be able to say, well, you're at this physical capacity. This is your current aerobic capacity, and this is the level of activity that you're hoping to do. If it's way off, then it's a clear cut, you're not there yet, but it can be a goal for the future. I'm going to include this compendium link in the show notes. If you ever have this come across, question-wise, can I do this activity? They have all kinds of things on there like hunting, seeding, planting seeds in a sitting position, in a stooped position. Lots of different, very specific items, which is awesome. Something else that's new in the 2024 update is they broke it down by age group. So it used to just be, the prior one was done in 2011. It was a 2011 compendium, and it was just broad. It didn't have specific age groups. So now they broke it down into greater than 60 years old, which is the older adult category. And I believe it's 19 to 59. So you have this range of age that you can look at. And it's really nice that they did a transition at that 60-year-old mark, because as you age, your resting metabolic rate is also going to change. So it's going to be a different effect. And all of these numbers are based on prior research of physical activity and comparison to VO2 max or MET levels or MET per minute. And they've done the conversion to get it to a specific number. They also, in 2017, made a pediatric, I think they called it a young adult compendium. So now there are a number of different things, a number of different categories you can look at for different age groups, which is phenomenal because now it's not just this really gross guesstimate, it's getting closer. So it's a living document. It gets updated every so often. I honestly didn't know it got updated until I was looking for this link to include into the show notes today. So I'll include that, and I'll include the article that's attached to it because this is super helpful, and you can actually help your patients understand why an activity is safe or not safe, or they're capable of doing it, or your concerns related to it. And more importantly, create goals that are specific to something that they want to do and gradually get there, which I think is a wonderful part of what we do and help really optimize your person and let them be successful in their life, right? All right. Do I have anything else? We talked about MET levels. We talked about heart rate and blood pressure adjustment for each MET. We need to consider that when we're thinking about activity, right? If they're resting at 100 and they're doing an activity like mowing the lawn, which is 5 MET levels, you can expect a 50 beat per minute-ish increase with that activity. Now you're at 150 beats. What does 150 beats look like in comparison to their max heart rate? What percentage are they working at? And this again is where time comes into this, because it's a very different story if you're doing something for 5 minutes versus 1 to 2 hours, right? It's a whole different ball game. And it's part of the conversation and also part of what you can help your patients get back to. All right. I hope that was helpful. This was a short one today. I hope you get some use out of this compendium. I'm dropping it in the show notes. Take a peek at that. If you have any questions, please reach out to me. If you are looking for mentorship one-on-one, I have a link for that as well. And I hope you all have a wonderful day, and whatever you have to do, get after it.